order, I just need to run through a few points. I remind honourable members that there have been some changes to normal practice in order to support the new hybrid arrangements. Timings of debates have been amended to allow technical arrangements to be made for the next debate. There will also be suspensions between each debate. I remind members participating physically and virtually that they must arrive for the start of debates in Westminster Hall. Members are expected to remain for the entire debate. If members attending virtually have any technical problems, they should email the Westminster Hall clerk's email address, and members attending physically are asked to clean their spaces before they use them and as they leave the room. Order. Sarah Olney to move the motion.
Thank you very much. It's a pleasure to serve under your chairmanship and also to be a part of a debate where members can participate virtually. It's a real pleasure to have our virtual members as a part of this debate this afternoon. Maternal mental health should be amongst our principal concerns. Pregnancy and birth can be the trigger for poor mental health amongst those who didn't previously suffer from mental health problems, and a major factor in the escalation of existing ones. But the first 2 years of a child's life are vital in their development, and the right support and guidance for families at this time can make a big difference to their long-term outcomes. For many women, becoming a mother presents psychological challenges. They may have experienced conflict or abuse in their own childhoods, which resurface when they contemplate the reality of becoming a parent themselves. They may be used to setting high standards for themselves and derive their sense of worth from their ability to meet them, but find their baby doesn't comply with their drive to meet their parenting targets. They may simply be overwhelmed by the awesome responsibility of having another human being entirely dependent upon them and fear that they don't have what it takes to be able to be an effective parent. And because everybody's had a mother at some point in their lives, we all, knowingly and unknowingly, have formed a picture of what a mother is and what a mother should do. These assumptions about motherhood crowd around every new mother, complicating her own feelings about her new baby and her new role. New motherhood can be extremely lonely, especially the dark, still hours of the early morning feeds, and this loneliness creates a fertile space for doubts and anxieties. Lockdown has exacerbated so many of these issues, and that's why I've asked for today's debate, so that we can talk about the impact of COVID on the mental health of new mothers, and to urge the government to prioritise this as we come out of lockdown. Loneliness has been a major issue for almost all of us during the last year, but the lack of contact has been particularly acute for those who've had babies during this time. I'm enormously grateful to the Parliamentary Digital Engagement team who organised a survey in advance of this debate to ask members of the public for their experiences. We had over 11,000 responses, and there was some extremely moving testimony amongst them. I want to thank everybody who took the time to share their experiences, but especially those people whose experiences were difficult and painful. The overwhelming theme of these responses was how difficult isolation made the experience of giving birth and caring for a newborn. I was particularly struck by the experience of Zilia from the southeast when she told us, all appointments attended alone and in sterile conditions, childbirth alone, no visitors in hospital, no family able to meet your newborn and help you out thereafter, just the most isolating and lonely experience I've ever been through. Reflecting on my own experiences, I know that I overcame the early challenges of motherhood with a combination of a supportive partner present at the birth, a delighted family who rallied around with practical help, professional health visiting support delivered through home visits, and a peer group of other new mothers in the neighbourhood. To have been denied any one of these would have made the job of adjusting to motherhood considerably harder. We now have thousands of mothers who are battling through the early months of motherhood without having had any of these essential forms of support, and this has taken its toll on their mental health. This is how Emily from Scotland describes the impact on her. My mental health is awful. I've never felt so lonely or isolated. I shielded from March until June last year and saw nobody for my second trimester other than my husband. My husband's family are yet to meet our baby, who's our first, and he's coming up for 6 months old. I've developed postnatal OCD, which is horrendous, and I'm still waiting for professional help to cope with this. Other COVID-19 factors that have worsened the experience for new mothers in lockdown are financial uncertainty, lack of access to childcare, and bereavement. The industries worst hit by the lockdown employ a large proportion of females. 20% of mothers have lost their jobs during the pandemic, compared to 13% of fathers. The closure of schools has left many mothers trying to juggle homeschooling for older children with looking after a newborn. and many families are dealing with the trauma of losing family members to COVID. The impact of the pandemic has changed the way that we all access healthcare, as resources are prioritised towards emergency admissions and efforts are made to reduce contact. In some parts of our healthcare system, this has led to an increase in digital and telephone consultations, and in many parts of the country, this has included perinatal care. Many of the respondents to the survey reported receiving follow-up care in this way, including Jennifer in the West Midlands, who reported very limited midwifery care. I didn't see a midwife at all until I was 28 weeks, no health visitor service whatsoever. Apart from one very brief phone call, I've had no contact from a health visitor. My baby has not been weighed since 10 days old, and they're now almost 6 months. Overall, my pregnancy experience has been unnecessarily stressful and left me feeling constantly anxious and unsupported. In my conversations with new mothers in my own constituency, many of them brought up how difficult they found this lack of professional support. They were unable to access guidance about breastfeeding or sleeping, unable to ask questions or seek reassurance. Many of them found that they experienced much greater anxiety about their babies as a result. I have at least one case in my constituency where the lack of a physical examination led to a major genetic condition being missed, one in which, tragically, early intervention can make a significant difference to quality of life. The survey we conducted found that of those mothers who'd received an online consultation, 60% found that they were not affected, compared to only 3% who said that they were. I've spoken to the Institute of Health Visiting and the Royal College of Psychiatrists, and they have confirmed to me how vital this face-to-face support is for new mothers in the first weeks. The value of the home visit is that the mother doesn't need to identify the need for help and then go out and seek it for herself. Someone comes to her and asks her how she is. A trained and experienced health visitor can observe mother and baby and identify whether additional support is needed. This kind of support cannot be replicated on Zoom or over the phone. Furthermore, as the Royal College of Psychiatrists highlighted to me, it is much harder to identify whether there are issues of domestic violence or coercive control between a mother and her partner when contact is one-dimensional. The impact of perinatal mental illness can have long-lasting impacts on families. As Stephanie from the East Midlands told our survey, I've previously not had any mental health issues, but I have really struggled with my mental health since having my baby. I have severe anxiety and now perinatal OCD. I have intense fear and stress about leaving my child, and I'm not receiving anywhere near enough support. The long-term societal cost of perinatal mental ill health is estimated at $8.1 billion annually for each one-year cohort of births, and about 3/4 of this cost is the cost of the impact on the child. The financial value of early interventions to support struggling families is clear. There's also the very human value of building loving and supportive families. We have the structures and the mechanism to provide this support already through the health visiting service. I should declare an interest here. My own mother was a health visitor for many years, so I've learned firsthand from her about the times when a friendly knock on the door made all the difference to an overwhelmed new mother. But this was a service that was already chronically underfunded and understaffed before the pandemic took hold. There's been a 31% decrease in the health visiting workforce since 2015, and many local authorities target their scarce resources to those deemed most at risk. I believe that only a universal health visiting service can properly identify and support mothers who are suffering from poor perinatal mental health, and that the government should allocate sufficient resources to enable this to happen. We need better mental health support for all ages and stages, and better training throughout our health service to identify and support those who are struggling. But providing the support to new mothers should be a priority because of the impact that their poor mental health can have on the development of their children and on the rest of their family, and because of the long-term impacts that this can have. The first step is to address the shortage of health visitors. There cannot be quality service provision when 65% of health visitors have caseloads of more than 500 children each. We also need to urgently address the staffing shortage amongst midwives, who have a critical role to play in supporting women's emotional well-being during pregnancy, childbirth and beyond. The Royal College of Midwives have found that there is currently a shortage of 3,000 midwives. Alongside this, we need to increase training and specialist mental health support for midwives so that they are well equipped to deliver the necessary support. The pandemic has forced us to use digital tools in every area of our lives, and we may find that we continue to use some of these tools even after face-to-face contact is possible again. If I could make one plea to the Minister, however, it would be that we should not allow digital and telephone perinatal checkups to become the new accepted standard. The government should fund and resource home visits by health visitors to all new mothers so that we can properly address the issue of maternal mental health. Thank you, Chair.
The question is that this House has considered maternal mental health. Tim Lowton.
Mr. Robson, thank you very much, and it's good to see you in the chair in this new chamber, which is a first for us all. And can I firstly congratulate the Honourable Lady for Richmond Park in bringing this debate today. And it's good to see we've had a number of debates in recent months to do with maternal challenges during the pandemic, the impact on families and the impact on mental health, both of parents and of children. And there's a little that could be more important, frankly, and it's something we will have to spend a lot of time concentrating on as we build out of the pandemic in coming months. Let me declare my interest as the chair of the All-Party Parliamentary Group for 1001 Critical Days, and from the Honourable Lady's comments, I think we have a new recruit. If she's not already one of our members, I'll be delighted to welcome her along, which is a very active group, and I chair the All-Party Group for Children as well. Until recently, I was chairman of the trustees of the Parent Infant Foundation charity as well, which concentrates on those initial 1001 days and attachment between parent carers and their children. I was impressed by the response from the digital teams in the House. I think it's a very good exercise. The Honourable Lady said 11,265 responses is not to be sniffed at. Alas, their responses were all too familiar from the anecdotes we've heard from our own constituents from what's been going on during lockdown. Responses about parents and particularly mums feeling lonely, isolated in hospital, particularly if they have to stay in for any length of time because of complications, with problems even getting their partners, the fathers, to be able to come and visit them. Feeling isolated from family support networks that we would normally take for granted. Isolated from new mum and baby groups, which I think one of the respondents in that survey responded to as a safety valve, particularly if you are a completely new mum. You learn from other mums, either new mums or experienced mums, and the interaction of those babies as well. And it was interesting how colleagues who have given birth during the lockdown, it was several months before their babies were actually able to meet another baby. And there was a bit of a shock factor there. We perhaps underestimate the impact of that social contact from the very earliest stages after a child is born. But particularly, as Honourable Labour has mentioned, the isolation from health professionals on a face-to-face basis. And although I know a lot of substitute virtual visits have been made, it is no substitute, and it must not become the norm, because health visitors in particular, and certainly we need to build back up our health visitor numbers, as we did so well in the coalition government between 2010 and 2015, produced 4,200 additional health visitors. They were absolutely invaluable. They are the friendly face that new parents will welcome across a threshold, where they may be more suspicious of a social worker or other care workers. And they're also an early warning system for problems that may be going on with a new parent, and ultimately safeguarding issues as well. Now, the report by the 1001 Days movement, and a report we produced called Working for Babies last year, said that services supporting 0 to 2s were highly depleted during the first spring lockdown last year. And the majority of services for 0 to 2s didn't bounce back quickly as lockdown measures were eased. And we need to make sure that that mistake is not made again this time. This lockdown has been especially stressful for first-time mums, as I mentioned, for single mums, for families having to balance working remotely, new forms of working COVID safely, or juggling with homeschooling if they've got other children as well. I just thank goodness that all my children have gone through the school age and we haven't had that additional challenge as well. But even before the COVID pandemic, Mr. Robinson, we know that 1 in 6 mums at least suffered from some form of perinatal mental illness, commonly anxiety disorders, depression. And we know that the pandemic and lockdown, as I've said, have impacted on the mental health of just about everybody, but particularly on that cohort of mums. There was a survey by Bliss, the excellent baby charity, amongst its members who've received neonatal care during the pandemic, which found that more than 90% of parents said they felt more isolated as a result of having a baby in neonatal care during the pandemic. 70% said that their mental health was negatively affected as a result of their experience. 56% said that mental health of their partner and wider family have been affected, and 47% said they were not offered support for their mental health while their baby was in neonatal care. And we know that in extremis, that suicide is the biggest cause of maternal death as well. And we have got to do so much more to make sure that women do not get in that position, and that support is there and accessible. And the shortage of health visitors, I think, is a false economy. I've always said that. We had a debate specifically on this issue last year, and I particularly pay tribute to Cheryl Adams, who set up and leads the Institute for Health Visitors, who is retiring at the end of this month. And the service she has done to that area has been absolutely extraordinary and has informed many debates in this place. And I just want to put on record our thanks and gratitude to her. There's also the whole issue of increased domestic abuse during pregnancy. The figure I can always find very hard to take on board is that a third of domestic abuse happens during pregnancy as well. We know that domestic abuse has gone up during the pandemic. So all these additional pressures on women who are about to give birth or have just given birth are extraordinary. And the cost of perinatal mental illness, calculated by the Maternal Mental Health Alliance some years ago, and it still holds true today and is probably an underestimate today, is £8.1 billion each and every year. On top of that, £15 billion, the cost of child neglect. £23 billion plus we are paying as taxpayers in the health service to get it wrong. And if we spend a fraction of that to prevent us getting wrong, and on those support services, the health visitors and those networks being there in the first place, then that will be money well spent and money well saved as well. And of course, key is a good attachment between babies and their parents or primary carers from those very earliest stages during conception as well. Hence, the first 1001 Days movement was founded. The 1001 Days Manifesto was launched by my Honourable Friend, the Right Honourable Friend, the member for South Northamptonshire, back in 2012, I think it was now, signed up to by cross-party colleagues, by the Royal Colleges, by clinicians and academics and children's charities alike. And it's still really relevant today. And to quote from some of the research by the 1001 Days movement and the Parent Infant Foundation, and particular tribute to Sally Hogg, who does so much of the good work there, it's estimated that around 10 to 25% of young children experience significantly distorted relationships with their main carer or carers, and that will predict a range of poor social, emotional and educational outcomes in childhood and across the life course. Maternal mental illness in pregnancy in the early years of a child's life can have adverse effects on the child's brain development and long-term outcomes. Maternal mental illness can affect children both directly and indirectly. For example, exposure to stress hormones in the womb is thought to affect the child's developing stress response systems, and after birth, mental illness can affect a mother's ability to care for her baby, her parenting style, and her developing relationship with her baby. Even relatively mild mental illness, if untreated, can inhibit mothers' abilities to provide babies with the sensitive, responsive care that they need. And again, a statistic I always use: if you have a 15 or 16-year-old teenager suffering from some form of depression, low-lying mental illness, there is a 99% likelihood that that child's mother suffered some form of perinatal mental illness as well. The connection is that close. So why are we not doing more to support the mother before and soon after she gives birth? Because the implications of not doing that will be with her child and her for many, many years to come, and often into adulthood for those children. So it's important to note also that whilst perinatal mental illness increases the risk of disruptions in early relationships, they're not inevitable. Some mothers can continue to give their babies a sensitive, responsive care that they need, particularly with the right support. And there is good, effective support available, if it's available. And that's the problem, that it's not always there, and it's not always there at the right time or in the right place. Now, other risk factors, Mr. Robertson, put early relationships and infant mental health at risk include families where fathers or other caregivers have serious mental health problems themselves. And again, we underestimate the impact of becoming a father, particularly for the first time, on the mental health of dad as well. This is a joint partnership in most cases, and fathers often get overlooked. They often get excluded from the whole neonatal process within hospitals as well. They need looking after too, because if they can be looked after, they can look after their partner, and there's a mutual benefit from all of that. We need to do more for fathers. So, Mr Robinson, the NHS long-term plan does include a commitment to expand access to evidence-based parent-infant interventions within specialist perinatal mental health services, and that indeed is welcome. It will ensure that attention is given to the parent-infant relationship alongside mother's own mental health when mothers have moderate or severe mental health problems. We mustn't just look at the child or the mum in isolation. We're looking at the bonded family. However, access to mental health services for babies should be dependent on the risks to their mental health and not contingent on other factors such as their mother's mental health needs. So the NHS Long-Term Plan for England also committed to improving access to specialist services for all children from 0 to 25. But delivering this commitment requires specialist provision for all babies who need it, as they are children too. Such provision would need to be delivered by parent-infant specialists. However, the NHS long-term plan says nothing explicitly about specialist mental health services for the youngest children in their own right. So the solution, Mr Robertson, is we need specialised parent-infant relationship teams providing therapeutic support where baby's development is most at risk due to severe, complex and or enduring difficulties in their relationships. They focus on the relationship between a baby and his or her parents or caregivers as the main way in which to improve infant mental health. But there are fewer than 40 specialised parent-infant relationship teams in the whole of the UK, and most babies live in an area where these services just don't exist, and vast areas of the country have no provision. And that's one of the aims of the Parent-Infant Foundation charity, which was set up by the Honourable Right Honourable Lady for South Northamptonshire, setting up these parent-infant projects around the country where practitioners were available to work on the attachment of parents and their children. We just need it to be mainstream across the whole of the National Health Service. So, Mr Robertson, as the Society of Royal College of Psychiatrists have said, the need for more perinatal psychiatrists to work in these services is crucial. These specialist services need a highly trained specialist workforce, but the workforce census in 2019 showed that 13% of consultant perinatal psychiatrist positions remain unfilled, and without more psychiatrists, ambitious plans to transform and expand services will be put at risk. We are soon to have the Leadsom Review, Mr. If I can call it the Leadsom Review, or doesn't really ring true as the South Northamptonshire Review, but the Right Honourable Member for South Northampton is producing her review, hopefully later this month. It will be published. I've been privileged to play a part in that and chaired a parliamentary advisory group. And absolutely key to that is having a joined-up support service between the NHS and local government and other key professionals to give that wraparound service in those crucial early months and years to parents. To have a digital record so that all those professions are working from the same information rather than every visit to mum is a new visit. To make sure that there's a national template of the quality that we need to reach, but with local implementations so that a service in Richmond may look a bit different to a service in my part of the world and the Sussex coast, but it needs to produce the quality outcomes and thresholds as well. And we very much look forward to that report in coming weeks and months, and I very much hope that the government will take it on board and produce the goods, because little, if anything, is more important, Mr Robertson, than the welfare and good health and good mental health of our children, and that is given the very best opportunity, the best start in life, if that child's parents are in a safe and stable place as well.
In order to call everyone, I wonder if I could ask all backbenchers to stick to around 5 minutes in their contributions, please. I know going virtual, Elliot Reeves.
Thank you, Mr Robinson, and I also want to thank the Honourable Member for Richmond Park for securing this important debate today. Maternal mental health problems are prevalent and not talked about often enough. 1 in 5 women will develop some form of mental health problem during their pregnancy or in the year after birth, and research suggests that as many as 7 in 10 mothers will underplay the severity of their feelings due to stigma surrounding mental health. Sadly, all of this has been exacerbated by the impact of the pandemic. And as someone who has spoken in this place before about suffering from prenatal depression whilst pregnant with my first child, this is an extremely important issue for me. From a personal perspective, my second child was only 4 months old when we went into the first lockdown. My plans for baby yoga, music classes and meeting other mums for coffee to get through the sleep deprivation were suddenly out the window. Instead, the coming weeks were spent with him mostly in a sling whilst I homeschooled the eldest. With much of his little life spent in lockdown, his 1 year check was done on the phone. He hasn't been weighed since he was 6 weeks old, and I cannot remember the last time that he saw a health visitor. Yet I feel lucky that he was born just before the pandemic hit, so my husband was able to be there for the whole time that I was in labour. Lucky that he was my second child, so at least I had a vague idea about what I was doing. And lucky that we had those 4 months together before going into lockdown. I know that for many of my constituents, having a baby during lockdown has been incredibly challenging. One of my constituents, Nina, wrote to me last autumn saying this: I was pregnant for the entirety of the first lockdown and had to attend all scans for the twins I was carrying alone. This was bearable when I looked around and saw everyone else making huge sacrifices. When I gave birth to the twins in August, continued restrictive rules meant that my husband could not be with me on the labour ward. Add to the mix a fast-moving induction, and I ended up giving birth to my babies with only midwives I'd never seen before in the room. My husband simply wasn't able to make it in time. If he'd been able to stay on the ward, I would have had his much needed support throughout labour. As it was, I had to recover mentally from a fairly traumatic experience. And yet I brought the twins home while everyone was still eating out to help out. How can this be right? Why do women, and particular mothers' needs, fall so far down the government's priority list? Nina's story and many others show the profound impact the pandemic has had. Whilst in September, the government allowed families with a child under 1 to form a support bubble, and the NHS now allows a birth partner to be present during labour and birth, for many families, these changes came too late. The government must now be ambitious in its plans to support the babies born in lockdown and their families, and this will be a huge task. For example, if health visitors are to catch up with the huge backlog in missed face-to-face appointments and provide a full service, proper funding will be needed. They provide an amazing service and invaluable support to parents, but around 1 in 5 health visitors were lost between 2015 and 2019 due to public health budget cuts. As a result, in February before the pandemic hit, almost a third of health visitors reported they are responsible for between 500 and 1,000 children. The Institute of Health Visiting considers the optimum maximum for the work to be fully effective is 250 children. Similarly, since 2010, cuts of 66% have led to the loss of over 1,000 Sure Starts and children's centres, which provide huge support to families, particularly those who are vulnerable or hard to reach. Funding needs to be restored so that there's a one-stop shop for parents to get support for themselves and for their children. Early years and nursery providers also provide huge support for parents, yet according to the Institute for Fiscal Studies, they ran at a significant loss during the first lockdown, receiving less than £4 of income for every £5 of costs. In addition, playgroups and baby activities are often run by small businesses, and restrictions have meant that their doors have been largely shut. I'd like the government to look at urgently sector-specific grant funding for urgent years to maintain the viability of the sector as we come out of the pandemic. It is clear that the added stresses of lockdown and the pandemic have exacerbated maternal mental health problems, with a recent UK-wide study published in the Journal of Psychiatric Research, finding that during the first lockdown, 43% of new mothers met the criteria for clinically relevant depression, and 61% met the criteria for anxiety. Given the consistent evidence that shows postnatal depression and anxiety are linked to a range of negative outcomes in terms of the health, development and behaviour of children, it's imperative the government does everything it can to protect maternal mental well-being. This starts with many of the measures outlined above, but also by improving and maintaining access to perinatal mental health care. Although NHS resources and staff are under huge strain, investment is needed to ensure mental health interventions can be timely and effective to prevent the escalation of symptoms and a potential larger burden on the NHS and other public services forming. This is not beyond our capabilities, and we owe it to the babies born in lockdown and their families to put this at the top of the agenda.
Now stay virtual and we pass to Sherilyn McRory.
Thank you, Mr. Robinson, and I'd like to thank the member for Richmond Park for securing this very important debate this afternoon. We've heard today some of the shocking figures around mental health, maternal mental health, and the evidence that new mothers have experienced poor maternal mental health as a result of the pandemic even. The study on maternal mental health and coping during COVID-19 lockdown and the new mum study found that over half of new mothers were reported feeling down, lonely or irritable, and that 71% reported feeling worried since the beginning of the first lockdown. Mental health services from guidance from the Royal College of Psychiatrics sets out that the perinatal mental health care continues to be essential during COVID-19, and that face-to-face contact will be necessary in some circumstances. The government and the NHS have said that mental health services, including specialist perinatal mental health services, remain very much open for business during the pandemic, and that providers have looked at how they can maximise the use of digital and virtual channels. And I agree that it is not ideal, but I do also have to acknowledge that hospital trusts in very difficult circumstances have worked extremely hard to try to reach out to mums. In Cornwall, the Royal Cornwall Hospitals Trust looks after 4,000 babies and mums every single year. And I'd like to thank the midwifery team at the RCHT for looking after me and both of my babies, one surviving and thriving and one who unfortunately we lost. They have been continually reviewing visiting throughout the pandemic, and the latest arrangement for their services are that their birthing partners are now available, and neonatal units, both parents can be there at any time. And partners can now attend the 12-week and 20-week scans, and if other scans are required, then they can also arrange that, and that is coming on from where we were during the first lockdown, so things are improving. International data, including some high and middling income and low income countries, suggest that perinatal illness is more prevalent in rural women, and this is the second dimension that I would like to add to today's debate if I possibly can. Cornwall is predominantly rural, and I think that the pandemic has absolutely exacerbated an already hidden issue and put it into the limelight. When you're a new mum and live rurally, it's very difficult to access baby groups. It's very difficult to access other new mums. It's very difficult to share stories and get peer support, mostly because of transportation issues. And I agree that all new mums are suffering this in lockdown, but it's particularly an issue for rural new mums. Often rural new mums are of a lower socioeconomic income, and so they can't afford to get to anywhere. And it's also very difficult for health visitors to get out and visit them. When I was a brand new mum, I didn't get a midwife follow-up appointment. I had a phone call, and I think on my notes I was given, I was told that I was well supported and it was and absolutely fine. Yet 8 months later, I was diagnosed with postnatal depression. I didn't know I had postnatal depression. I thought I was tired. I thought I wasn't doing it properly. I thought I was not living up to being a real mum. I didn't know who to talk to. Even though I had very close family support, I felt like I just wasn't doing it right. And until I broke down one day and saw my GP, at that point I was diagnosed with postnatal depression. And luckily for me, not being in lockdown, I was able to go to a group peer support and meet other mums who were feeling exactly the same way, and actually realise that I was perfectly normal, and this is something that you will work through. And I think it's really important that we do recognise that this is going to be a growing problem because of COVID. I think that, you know, it is all about talking when you're a new mum. You do want to speak to other new mums, and when you can't do that, you know, you get lost in your own head, and everything feels a bit worse. I also have been working cross-party with my right honourable friend, member for South Northamptonshire, and my honourable friend, the member for Wortham and Shoreham, on the early years review, for which I'm really privileged to be a part of at this late stage. It started its life, as we know, as the first 1001 days. I won't repeat the words of my honourable friend who articulated this work absolutely wonderfully, but I do look forward to the review coming hopefully later this month. My right honourable friend, the member for South Northamptonshire, was quoted as saying, the fact that babies have had little social contact during the first lockdown is clearly a bad thing. And she said that the repercussions are not yet known. And tackling some of the awful experiences for babies during lockdown and looking at how families can benefit from some of the positive experiences will be at the heart of this review. I look forward to its findings, and I hope that we can improve the conditions for new parents and new babies going forward because of it. I also hope that when the new review findings come forward, and when policies are formulated, it's my sincere hope that all parties take a really long-term view of all the important issues that we're discussing today and that come out as part of the review. I want to ensure that policymakers cease to use something as vital as the best start in life for babies and the mental health of mothers as a political football, and hopefully we can formulate something wonderful going forward that when we look at it, back at it in 20 years' time, we can see how successful it has been, and we can all be very proud of it. Thank you.
Thank you. I now call Maria Miller.
Thank you, Sir Edward, and can I commend the Honourable Lady for Richmond Park for securing this debate today, because the 750,000 women who've given birth during this pandemic have experienced not only all of those challenges that every woman experiences when they give birth, but they've had those problems magnified, as other members have already set out, issues around isolation, anxiety, the need for proper professional support, as identified by the excellent piece of work done by the digital engagement team for the Honourable Lady, are things that all of us who've been new mums can really relate to. But I can only imagine how much more these issues can affect people when they have no family members to call on, no mother's group to go to get that sort of personal experience from others who've gone through it before them. We know that outside of the pandemic, around 1 in 5 women experiences perinatal mental health problems, which impact not only them but also their children. And we know, as my honourable friend, the member for East Worthing and Shoreham, said earlier, that this can be a cost of some £8 billion to the economy every year. And I'd like to just add to this debate by looking at the conditions that create a higher likelihood of mental health problems emerging in the first place. And when you look at the research, that is particularly around stressful life events. And we know that during the pandemic that people have particularly been highly anxious, far more anxious than they might otherwise. And indeed, some of the research would suggest that pregnant women, around 3 in 4 pregnant women, have had significant anxiety, and up to 40% have experienced depression. And one of the biggest anxieties for any new parent has got to be money, finance, income, making sure that they can care for their new family. And most families now have 2 working parents, and families depend on both incomes. So the fact that more than 50,000 pregnant women a year suffer discrimination that leaves them with no option but to leave their job should sound alarm bells, not only for our economy, but also for the potential for it to trigger mental health problems, depression or anxiety. And work by organisations like Maternity Action and Pregnant Than Screwed has shown worrying increases in reports of pregnant women losing their jobs during the pandemic. And we know that more women have been impacted in terms of job loss during the pandemic than in other similar economic events. And we know that the reported figures of 50,000 pregnant women each and every year leaving their jobs is likely to be the tip of the iceberg. And as well as those reporting leaving their jobs, there'll be many more who are silenced from speaking out through non-disclosure agreements. Now, my right honourable friend, the Minister, speaking from the front bench today, has done so much to support new mothers, but support them to only see that some of those women are let down in the workplace. So as part of this debate, can I urge her to consider employment policies too, particularly given the impact of coronavirus on women's employment? Because no matter how good she is at her job, in terms of putting support in place, if pregnant women are then concerned about losing their jobs, even if they don't, but being pushed out of work is not something that is uncommon for people to see in the workplace when women become pregnant, then the Department for Health's job is going to be severely undermined if these issues aren't addressed. In other countries who've looked at this closely, I believe we can learn from their experiences. Countries like Germany, a similar economy to ours, prohibits pregnant women and new mums from being made redundant for the good of women, for good of their children and the good of their families. And I've put the idea of adopting the German laws here in the UK in a 10-minute rule bill, and I hope my right honourable friend will look at it to see if it's something that she could lend her support to as well. The final point I'd like to put, Sir Edward, is that mental health problems on the arrival of a child don't always just impact women. Up to 1 in 4 fathers can experience mental health problems in the year after the birth of a child. So it can be difficult for fathers to manage that transition, and we need to ensure the support is there. Shared parental leave policies on a use it or lose it basis, again in other countries, have proved to help fathers with that transition. And could the Minister look at why we're still awaiting action following the review of this policy in the UK, which would explicitly help fathers tackle these difficult issues? Sir Edward, my right honourable friend has done so much, but she needs her colleagues in Bays to do more. It's no good saying we have good maternity protections when the government knows 50,000 women a year probably lose their jobs because of the way they're treated in the workplace. So could I ask the Minister to speak to her colleagues in the Business Department to look at effective broader policies impacting pregnant women at work, because one of the most effective maternal health policies this government could adopt is to stop them being made redundant in the first place.
Thank you. Because members have gone on beyond 5 minutes, I've got to reduce the time limit again now, otherwise not everybody will get in. So the time limit is now 4 minutes. And we go virtual to Liz Twist.
Thank you, Sir Edward. It's a pleasure to serve under your chairmanship. And I'm glad to have the opportunity to take part in this important debate today. And can I start by congratulating the Honourable Member for Richmond Park for securing this important debate. Sir Edward, having a baby is something that most mums have looked forward to, and the birth of a child to family and friends and people we know is something that all of us greet with joy and pleasure and anticipation for the future of the child. But we know that for some women, pregnancy and the time after birth can sadly be difficult, and something that they may not feel able to talk to people about when everyone is imagining they're having a happy time. And this year it may have been more difficult than ever as a result of COVID-19 and the social isolation it's brought about for so many. They've not been able to have the support and share the joy and the workload with family and friends, and it's been difficult to have that face-to-face support which they really need. And let's not forget that for many too, they have lost out in the financial support offered to others, as campaigning organisation Pregnant Then Screwed have evidenced. Low mood, anxiety and depression are common mental health problems that occur during pregnancy and in the year after childbirth. The pain these conditions cause women and their families and the negative impact they have on their health and well-being are significant. The Royal College of Obstetricians and Gynecologists say that up to 1 in 5 women develop mental health problems during pregnancy or in the first year after childbirth, and around 1/4 of all maternal deaths between 6 weeks and a year after childbirth are related to mental health problems. Sir Edward, sometimes hearing the lived experience of constituents in this House really brings home the issues we're discussing and the need to address those issues and needs. A constituent of mine has asked me to tell her story. In 2017, I became a mum for the first time. I knew that I needed to provide for my child, but I felt no more attachment for someone I had just met. I started to Google how to have my child adopted and felt like I was a failure as a woman. I started to have panic attacks. I'd imagine walls falling on my child, people grabbing her and running away. I would lock myself in the house and was terrified to be alone. It was when I started to record the times that trains went past my house that I realised I was seriously contemplating suicide. I went to the GP, who made an urgent mental health referral, although it was 5 months after my child was born that I actually got any help and anything was done. I was diagnosed with severe postnatal depression and been receiving help ever since. When my second child arrived, I realised just how traumatic my first experience has been. The shame and anguish have been replaced by joy and love, and I was finally able to have those special moments with a newborn that people romanticise. Now, since that time, the local clinical commissioning group, Newcastle Gateshead, has invested in a specialist perinatal mental health service. This provides support, advice and planning of care and treatment following delivery, reducing the risk of significant illness and the potential inpatient care. However, so many women are not seeking the help they need, and the pandemic has had a huge impact on loneliness, making those early days so difficult. Sir Edward, it's important, this is an important debate, and we must do so much more to support women struggling with their mental health before and after the birth of their child, to allow parenthood to be the joyful, if challenging and tiring, experience that it should be. Thank you.
Stay virtual for Mary Kelly-Foy.
Thank you, Chair, and thank you to the Honourable Member for Richmond Park for bringing this debate forward. And I'll declare an interest as co-chair of the APPG for cerebral palsy. Maternal mental health has been one of the hidden impacts of this pandemic. Being a new mum is a special time for any woman. However, it can also be overwhelming and generally challenging. In normal times, many women receive support from their family and friends who are there to offer invaluable guidance. Yet for the last year, the public health restrictions needed to tackle COVID-19 have meant that many women have had to make this journey on their own. I had my first child, Maria, at 21. The advice from my mum was crucial in spotting the missed stages in her early development, which enabled her cerebral palsy diagnosis to come much sooner than it otherwise would have. And I kind of put into words how valuable her support was following such heart-rending news. But it was thanks to my family and friends that I felt confident enough to go on and have 2 more children. And it strikes me that if Maria had been born during this pandemic, then the personal support I received from my mum and health visitors would have been so much more limited. And my heart truly goes out to those who've become mothers during this pandemic. And I cannot imagine the impact isolation will be having upon their mental health. And I do worry that some may sadly choose not to extend their families in the future. The pandemic has also particularly affected those whose babies have received neonatal care, with more than 90% of parents who responded to a Bliss survey saying that they felt more isolated due to having a baby in neonatal care during the pandemic, while 70% said that their mental health was negatively impacted as a result of their experience. This situation hasn't been helped by the fact that Bliss research has also found that psychological support for parents experiencing neonatal care is inconsistent at best, with around half of parents saying that they were not offered mental health support during or after this care. However, the impact of negative maternal mental health goes beyond the parent, and it's not limited to the short term. As we've already heard, the first 18 to 24 months of a baby's life is critical in their development, and the stress and trauma of poor maternal mental health has the potential to severely impact the life chances of a child. In areas of the northeast where my own constituency is located, existing health inequalities already mean that some children begin their life with inferior life chances to those from less deprived regions. So we simply cannot afford to place a further obstacle in their way of their development and risking losing a whole generation. As a result of the pandemic, we're facing a potential mental health crisis in Britain, and maternal mental health is significant. It's unreasonable to suggest that as a society we could experience a collective trauma on this scale without it impacting on mental health. And this will inevitably be challenging, especially when the existing foundations for mental health care in the country were already so weak. It was therefore incredibly disappointing that health services were absent from the Chancellor's budget last week, and he could do with learning that the damage from this pandemic to public health will not fix itself. It seems fitting that we're having this debate during the week in which International Women's Day falls. Not only have women consistently stepped up to the plate during the pandemic with little to no reward, they've also shown their resilience in coping with one of life's toughest challenges, becoming a mum. And we owe it to the women in our constituencies that we have the best mental health support out there for what undoubtedly is one of the most beautiful yet challenging life experiences they'll face.
Thank you very much. We now go to Edinburgh for Christine Jardine.
Thank you very much, Sir Edward. It's a pleasure to serve under your chairmanship. And I'd also like to thank the Honourable Lady for Richmond Park for securing this important debate. It was during a recent Zoom call with friends that the real and current issues affecting maternal mental health struck home for me. I had experienced, but from what we would all support and care to be that all of us on the call with her that evening were both upset for her and inspired by her attitude. As an expectant mother, I had my family around me, mother, sisters, husband, friends, antenatal classes, the knowledge that there would be ample postnatal care and support. But in COVID-19, that is simply not possible. And the impact of that is to exacerbate a problem which already, in the very best of circumstances, will affect 1 in 5 women who give birth. Those women, and it could be any of us, will experience anything from anxiety to OCD or post-traumatic stress disorder. And I'm sure every one of us in this debate today has personal experience of a close friend or relatives, or perhaps even ourselves, who have experienced these problems after giving birth. Of course, we have come a long way as a society from when postnatal depression was described almost dismissively as the baby blues and talked of in hushed tones. We now acknowledge the scale and widespread nature of what many women have to cope with. We have heard many stories in this debate today, but I do not believe we are yet adequately responsive or providing the correct and sufficient care. In this pandemic, we know, like with so many other issues, it is also worse, much worse. Women going into labour at the moment have not had the benefit of face-to-face antenatal classes, forming bonds with the other expectant mothers for common support, or having the assurance that their partners can be there and their closest family or friends visit within a few hours, baby groups, or the postnatal visits. And all of it against the background of lockdown, perhaps a feeling of isolation, financial worries, or maybe keeping other children amused, cared for, or home schooled. And knowing that poor mental health for a mother can affect the future outcomes for the child, as we have heard, must be uppermost in our minds. We have heard the stories in this debate of the disruptions to life, the impact on the mental health of both mother and child. And it's clear that we need to listen to all of that and to act. Listen to the mothers now and in the future about how they are struggling and those who have struggled in the past. With no support network and delays for treatment, we need to ensure they are supported by healthcare professionals with sufficient training. We need funding. We need a system that provides robust, integrated physical and mental health care for new mothers. Maternal mental health must be a priority for this government, not only for the future well-being of mothers, but for all of our children.
Thank you very much. I call Jim Shannon, who's here.
Thank you, Sir Edward. It's a pleasure to speak in this. And first of all, can I thank the Honourable Lady for Richmond Park for bringing it forward. It's an important issue, and to all the right honourable members who have made very valuable contributions. They've set the scene very well. As a a great concern of mine, has been for many years, and I've raised this on several occasions in this House, and indeed I've probably spoken alongside my colleague and friend and others here as well on almost every occasion that has been brought forward. COVID has been very difficult for my family, Sir Edward, with the loss of a much-loved mother-in-law, but we have been blessed in that time with sunshine in the rain to have two new beautiful grandchildren, Max and Freya, both born during lockdown. Why is that so important? It's important to have that opportunity as a grandparent to have grandchildren and to have new grandchildren. So we're up to 5 now. I've got a 5-a-side football team, a mixed football team of boys and girls, but I look forward very much to that. But there was no joyful visit to the hospital. Indeed, the first view is through a living room window. And indeed, I haven't probably maybe seen the youngest one at all, even from a distance. It's always been on my wife's video or so on. Video calls are wonderful, but there can't be anything sweeter, I believe, than holding your grandchild. Tough as it is for grandparents, it's even more difficult for parents, and that's what we've been trying to say today, Sir Edward, and the contributions we're making. No mum or auntie allowed to come round to help. New mum gets sorted and into the routine. No mums or toddler groups to reassure the mum that she is doing a phenomenal job and that everyone struggles, and sometimes you just need someone to share that with. Just in these days, in a house with a baby that you're perhaps too frightened to take out into this very uncertain world. So the impact upon mums and dads has been vast, and we will not know the full extent of it probably in the years to come either. My parliamentary aide, Naomi, who is a very busy girl because she does all the speech writing for me, and she had 2 children in a very short time, and I remember them very well. And she often told me that one of her, and she refers to it as her mummy guilt, that her eldest had little opportunities to enjoy her own time before she became the big sister almost right away in very short time. She also talks of the mummy guilt of working full time. Although her parents are able to mind the children and they are well taken care of, the guilt remains that she's not the one picking them up from school, which is really what she wants to do. Whilst I can objectively look on at this and see 2 lovely, well-adjusted girls, she sees only the things that she feels that she didn't do right. And she says she's done wrong, which I don't believe that's the case, but she feels that. There's a feeling that all mums will be able to sympathise with when we add in the fact that lockdown babies are not able to see and interact with others, and that's important as well. But you can, when my grandchildren, or my children grow up and the grandchildren I've seen so far, their interaction with their wee colleagues at school, they make friends right away, and very, very often you'll see them holding hands with the person in P1 or P2 at school, because that's what children do. They need to have the interaction. They are more likely to be parented by the person who is home with them, and I can only imagine the feeling of isolation and guilt of what the child has missed out and what will be felt. I was very pleased to receive a number of correspondence, but one in particular from one of my colleagues wrote to me expressing the feeling of being robbed of her maternity leave and calling for an extension. So I can do nothing but support her in this call. The experience of lockdown for new parents has been difficult. No music classes, no parenting groups, no one to reassure you face to face and to see if you're truly okay. Add to this those parents whose children went to a neonatal unit. The baby charity Bliss has conducted a survey of parents whose baby received neonatal care during the pandemic. I'm not going to repeat the figures because the honourable gentleman repeated those figures, but just remind everyone, if I could, and perhaps the Minister, to look at those figures. Those figures.
Please.
Oh, say, yeah, I can say that. When I supported my colleague, the member for East Belfast, in the CDM, and I conclude with this, Sir, I'm very pleased to stand today with so many parents asking for help and support that is needed. Give them the support that has been so lacking for so long, and let them know that even when socially distanced, you're not alone.
Thank you very much. We now return to virtual for the SNP spokesperson, Dr. Lisa Cameron.
Thank you so much, Sir Edward. It's an absolute pleasure to serve under your chairmanship today, and I'd like to start by commending my honourable friend and the member for Richmond Park on bringing this absolutely vital debate to Parliament. I think it's crucial and it could not be more timely, so I thank her once again. Before I begin, can I just refer to my register as a clinical psychologist, and also thank the British Psychological Society and Maternal Mental Health Alliance for the work that they've been doing in this field, amongst so many other charities and organisations already referred to. And thank you to everybody who has spoken so thoroughly today on many issues, including the first crucial 1001 days, the importance of digital records, which I think is absolutely essential in assuring continuity of care. I understand the government are bringing support for family hubs in the future, so I'm interested to hear from the Minister a bit more about that and how that will support this work. The other issues that have been raised absolutely go to the core of this issue: mental health stigma and the impact of coronavirus on labour and prenatal care, and of course those members who have spoken so eloquently about their own personal experience. Absolutely crucial to ensure that we normalise well-being and mental health issues, particularly during this most crucial time in lives, but also give due cognizance to the importance of ensuring that people can access services when they need to do so. I mean, the first weeks, months and years of parenthood were absolutely some of the most difficult that I experienced, fraught with sleepless nights, anxiety about the future, and I think overly high expectations that I placed upon myself about the responsibilities of being a new mum. Support is absolutely crucial at these times, and it just hasn't been available during COVID-19. So before the coronavirus pandemic, more than 1 in 5 women experienced mental health problems during pregnancy or in the first postnatal year. And as is true of so much of our lives in the past year, COVID-19 has exacerbated these issues. The Baby Loss Awareness Alliance, led by Charity Sands, found that isolation was enhanced and had increased during lockdown, with feelings of loneliness impacting 63% of new parents compared to 38% before the pandemic, and those who'd experienced extreme difficulties during birth. If symptoms are allowed to spiral, more severe forms of perinatal mental health issues can have significant and long-term effects on mother, baby, father and the family, and many different types of family as a whole. Research evidence suggests the long-term costs of perinatal depression, anxiety and psychosis in the UK is £8.1 billion per year, equivalent to roughly £10,000 for every single birth in the UK each year. And whilst the financial weight of the failure to help new and expectant families is stark, the reality of families having to cope with perinatal mental illness is also absolutely heartbreaking, with maternal suicide making up one of the leading causes of death for women during pregnancy and in the first year after birth. In summing up this important debate today for our party, I'd like to highlight 2 issues to government and how I think things can be improved going forward. The first is that pharmacological interventions really have to be matched with high quality specialist psychological therapies during the perinatal period. Significant steps have been taken towards integrated care across the UK and in devolved governments in the past few years. However, much more I think needs to be done to ensure that maternal mental health needs are met in whichever context these first present. This might be maternity services, adult mental health services, drug and alcohol services, even learning disability services, or in child and adolescent mental health services who are supporting the whole family. But wherever families show signs of needing help, they must be able to access specialist psychological therapies as quickly and easily as possible if we are to ensure the best possible outcome. This must also apply to specialist perinatal community teams, and in many circumstances, these home visit teams are our first and sometimes our last opportunities to spot maternal mental health issues, and must include individuals with specialist training in clinical psychology. So the British Psychological Society has recommended that every specialist perinatal mental health team should include clinical psychology, and that every woman identified as requiring a psychological intervention should be offered an assessment and treatment with the clinical psychologist within 28 days. So I'd like to highlight that as a recommendation. In 2020, the Scottish Government invested 1.4 million in specialist community perinatal mental health services, with an additional 1.5 million in infant mental health and maternal neonatal psychological services across Scotland. I'd also like to urge the UK Government to set out additional supports to what has already been promised in the NHS long-term plan, in light of the additional and compound need that we've heard today in this debate. setting out the impact of COVID-19. This need is absolutely exacerbated, and it's crucial. We must not fail families at this time. Thank you so much.
Thank you very much. Now for the Labour spokesman, Dr. Rosanna Allen Khan.
Thank you, Sir Edward. It's indeed a pleasure to serve under your chairmanship, and it's an honour to respond on behalf of the opposition in this vitally important and incredibly moving debate. I'd like to thank the Honourable Member for Richmond Park on securing today's debate, and I really do feel that all interventions have been incredibly valuable, really highlighting the urgency in focusing attention on maternal health. Debates such as these hopefully go some way towards breaking down the stigma which still sadly persists both around mental health, but also around the often harsh reality of pregnancy, birth and motherhood. It's simply heartbreaking that suicide is the leading cause of maternal death, and as a society, more people are starting to speak out publicly about their experiences, but we do need action from the government. The current coronavirus crisis has had a disastrous impact on many women, and I've been honoured to listen to colleagues share their heartbreaking experiences of baby loss in a recent debate, and my heart breaks for all those women who've had to go through this alone at any time, and especially during the pandemic. It is simply inhumane. Can the Minister please outline what mental health support will be offered to women who experienced baby loss without their partner by their side? The effects of such tragedies have a long-term impact on partners and families too. Will any support be extended to families? We heard today very eloquently about the importance of also considering fathers and other partners during such circumstances. Within maternity services, there are huge inequalities. Black women are 4 times more likely than white women to die in pregnancy or childbirth. Pakistani women are more likely to have a premature baby or neonatal death in the UK compared to their country of origin. And women from all ethnic minority groups in the UK receive fewer home visits from midwives and are more likely to give birth by emergency caesarean sections. What's the government doing to address these discrepancies and to ensure culturally appropriate mental health support is provided? These racial inequalities are deep-rooted and only being further entrenched by COVID-19. People from ethnic minority backgrounds are more likely to be adversely impacted financially due to the pandemic, and the risk of death is much greater. The government's only response so far to these shocking statistics has been to commission further research into it, but we need action now. The evidence is already clear that there are persistent inequalities in maternity outcomes and experiences, and that discrimination, bias and a lack of cultural understanding is driving this. What action is the government taking to eradicate these gross examples of health inequality? The 5-year forward view for mental health made a recommendation that by 2020-21, in England, 30,000 more women each year could access evidence-based specialist mental health care during the perinatal period. During Monday's statement on women's health, I asked the Minister if she could tell us if this target has been met. We didn't get an answer, so can the Minister provide an answer today? Additionally, the NHS long-term plan outlined that an additional 24,000 women with moderate to severe perinatal mental health difficulties and a personality disorder diagnosis per year by 2023-2024 would benefit from evidence-based care. Could the Minister please outline how many women are now benefiting from this? We know that Health Education England was provided with £1.2 million of funding to increase skills and awareness around perinatal mental health. Could the Minister please outline today the progress of this and where training initiatives may have been hampered by the pandemic? The pandemic has had such a profound effect on people's mental health. We know how difficult and stressful pregnancy and birth can be at the best of times. And even outside of COVID-19, it's vital that perinatal mental health services should promote prevention, early detection and diagnosis for mental health problems. Many women have been struggling to access the services they need during pregnancy, leaving them having to go through A&E. This is hugely distressing and can cause great deals of anxiety on expectant mothers and their partners. It is therefore vital that those most at risk are getting the support they need now. Can the Minister outline what delays there have been during the pandemic in accessing perinatal services? Working in hospital, I've seen the fear that so many people present with, fear of contracting the virus, fear of taking the virus home, and fear of wasting NHS time. Preventative measures around mental illness are crucial and are especially crucial now for those most at risk, with over half of new mothers having reported feeling down, lonely or irritable, and 71% reporting feeling worried since the beginning of the first lockdown. What steps is the Minister taking to ensure new mothers know where to go to seek help? During the pandemic, a UCL report found that there was a redeployment of up to 80% of health visitors in some areas. This prevents the much-needed visits that my honourable friend spoke of earlier. These face-to-face visits are crucial in recognising issues early on and providing assistance. So can the Minister tell me what delays families have faced at this time, and whether any additional resources will be offered to those who missed out on face-to-face visits? As the mother of 2 under 2 at one point, I know how desperately stressful it can feel to have one baby and a new one already arrived. I know what it can feel like to feel as though you are failing at motherhood, failing at being a working mother, and just how challenging it can be. But I can't imagine for a moment what it would have felt like to do that through the pandemic. We rely so much on being in playgroups, having other mothers and fathers telling us we're doing okay, phoning the breastfeeding helpline at 2 a.m, worried that you can't make enough milk for your baby, and having someone say, don't worry, we can get the health visitor to come and see you tomorrow. These are normal things, but for so many mothers, it has been lacking throughout this pandemic, and I really fear for the effect it will have on them long term, them and their families and their children. In response to the Honourable Member for Sheffield Hallam asking last year about additional counselling and support being provided for those who gave birth during lockdown, I noted that there was no clear answer on proactive work that the government has done to provide support to new parents. Can I ask the Minister whether this is because no additional resources have been provided? And does the Minister recognise that maternal mental health has been overlooked in this crisis? Pregnancy and childbirth can be such a beautiful time in people's lives, but I know what it can feel like when it goes wrong. I know the fear of stepping into a hospital afterwards, the memories come flooding back, your heart rate goes up and you can't even imagine what it'd be like to be pregnant and go through childbirth again. These things can be overcome, but not without specialist help that people really rely on. I cannot imagine what it must be like for women going through this during COVID, and yet another barrier in the way of getting the help that they and their families so desperately need. Thank you.
Thank you, Sir Edward. And I would like to thank the Honourable Member for Richmond Park for bringing forward what really is an important debate. And we have had a number of debates about maternal health over the past year, but this is particularly important given the timing. Pregnancy and motherhood are a period of change, of great change for everyone. And it has been particularly difficult for those new mothers during the past year whilst they have been in the middle of lockdown. I would just like to pick up on a couple of points that she made. She cited a case study which I can't respond to because it's Scotland, and as she knows, Scotland is devolved when it comes to health. And in terms of the midwives, she questioned the number of midwives that we have. Actually, there's been an increase, and in fact that was mentioned by a number of members. There has been an increase of 14.6% of midwives, full-time equivalent midwives in trust and care commissioning groups over the past 10 years. And I'll just answer a few quick questions that came up. At workplace, announced the Women's Health Strategy. My own friend Wimbledon brought up the workplace. We need a call for evidence to gather the data that we need on what's happening to women in the workplace, both when they're pregnant and to do with their health. And I mentioned on Monday, to do with issues like endometriosis, menopause, or musculoskeletal issues that women suffer from more than men. All of that, we need that data, which is why we made the call for evidence. And I'll make it again. It's a very easy link to click on to women to let us know what is happening to them in terms of their health, both in the workplace setting and in healthcare setting. And we hope on the basis of that data and the number of respondents, which was in the thousands within a few hours of going live, that we can have the data that we need to help develop those policies in the workplace. And to my honourable friend who mentioned the Right Honourable Member for South Northamptonshire, who I spoke to last week, we weighed with great excitement the early years review. It started at the first 1,001 days, and the Honourable Member for South Northamptonshire, this has been her life's work. I've known her since she first came here as an MP and before. This is something she's absolutely passionate and committed to. And this cross-party review is going to be illuminating, and we're excited to see it launch, which I think will be later on this year. Whilst perinatal period can be a time of both celebration and joy, it can be, for some, be a time of considerable anxiety and worry. Indeed, like my friend opposite, when I became a mother for the first time, I was actually alone because my baby was 14 days old. My husband had to go and work abroad for 6 months. So I was completely alone. And I absolutely remember that time of waking up in the middle of the night and having nobody with me and being entirely alone, trying to breastfeed a baby and totally struggling and not able to do it. So I know, and I do remember how hard it is. And actually, I think I'm allowed to say I'm about to become a grandmother for the first time, and really hope that I can be there for that we're over this and out of it by the time it happens, and I can be there for my daughter to help her through what will be difficult times, because every new mother feels that. And I would like every pregnant new mother to know that support is there, and we are increasingly at a rate of knots expanding services. And there is no shame in seeking help, including through this pandemic. Specialist and inpatient perinatal and mental health services have remained open during lockdown, and with restrictions, but services have been providing digital and remote support. And for those with severe needs or in crisis, perinatal or otherwise, all mental health trusts have set up new 24/7 crisis helplines. I remember the call on the 4th of April last year when we decided that we'd do this, and they rolled out and they were open. And I spoke to the CEOs of Mental Health Trust, and one told me yesterday the volume of people using those 24/7 helplines has been tremendous. So we know that they've been set up and they've been used, including by new mothers. We also announced in the 2020 spending review up to an additional £500 million for mental health services. That's on top of the £2.3 billion a year that we're investing to address waiting times for mental health services and give more people the support they need. We've also taken action to ensure mothers can continue to have broader support throughout the perinatal period, both from statutory services and from family support. Health visitors, who are ideally placed to support families, and the health visiting services continues to provide an opportunity to identify families who may need support. And health visiting service has remained in contact with families throughout the pandemic and will continue to do so, and to prioritise very young babies and vulnerable families. Recognising the support a father or the mother's partner can bring, we published guidance in September to reintroduce access for partners, visitors and other supporters of pregnant women in English maternity services. We also launched a campaign to ensure that people continue to access services and to get support early. We've continued to deliver on the ambitions for maternity and mental health services that we had before the pandemic, to ensure that mothers get help earlier. And from April 2020, we've invested an additional £12 million per year for every mother to be offered a 6 to 8 week postnatal check with her GP. And I think my honourable friend campaigned on this for some considerable time. Throughout, and I apologise, but I can't remember his constituency either. There we go, for the record, for Hansard. Through the postnatal health check, every mother can now expect the opportunity and time to discuss any concerns that she may have about her physical or mental health and well-being. We remain committed to making perinatal and mental health services a priority through the NHS long-term plan. Now, this is actually very important. There is now a specialist community perinatal mental health service in every area of England. And we are further increasing access to perinatal services so that at least 66,000 women will be able to access perinatal mental health services in 2023-24. I actually went to see one of these perinatal, at the beginning of my time in post 18 months ago. These had just begun to roll out. And I have been to see myself one of these perinatal mental health teams working, and it was just tremendous. They'd only been operating, the nurses there had only been in place a matter of weeks, and they'd already had something like 120 something referrals and mums that they'd seen in just that time since they'd been established, which demonstrated the need, but also almost endorsed the reasons why they were there and highlighted the services that they were presenting and providing to those young mums. We are also, and this is also important, extending the length of time that specialist perinatal mental health community services will be available. So those services right now, which currently run from preconception to 12 months after birth, will be available from preconception to 24 months after birth. And we are developing and implementing maternal mental health services or maternity outreach clinics, which bring together maternity reproductive health and psychological therapy for women experiencing mental health difficulties directly arising from or related to the maternity experience. So, as my friend can see, we've put a huge amount of work into maternal mental health, and because she's quite right, I can't remember who it was who highlighted the fact, my friend opposite, that actually suicide is still the biggest cause of death from I think it's from 8 weeks post-delivery to 12 months, still the biggest cause of death in terms of maternal death. And that is why this is actually so important to us. In order to reduce those figures, to ensure that suicide isn't the biggest cause of maternal death, what we have to do is put the services in earlier down the line. So we need to make sure that both an antenatal stage and the check with the GPs at 6 to 8 weeks, with a qualified GP, and those perinatal services, mental health services, which are now available in every area of the country, are in place. And we've done that by, again, the funding that's been from the £2.3 billion, which has been allocated to the long-term plan. Whilst many who experience mental health in the perinatal period are treated in the community, there are, as my friend will know, a very small number of mothers who will need hospital admission for their mental health. Because it's right that where possible, we keep the mother and child together. And this is why, this is also an announcement I'm proud of, a fact I'm proud of, this is why NHS England has expanded the capacity of mother and baby units in England with additional 4 to 8 bed units now providing specialist care and support to mothers who are experiencing severe mental health during and after pregnancy. And I checked just before I came in for this debate, we're now up to 152 beds across England, which is a tremendous increase in the number of those units. And it is so important to keep the mother and baby in those first days together as much as is possible. These units, they support women with serious mental health issues by keeping them together with their babies and with specialist staff who nurture and support the mother-infant relationship on the ward at the same time as the mother is treated for her mental illness. That is a huge step forwards from how that used to be not so long ago, to be in the place where those mothers who are at that severe stage of mental health illness, post-delivery, have that treatment in those beds with those specialists, mother and baby together, and those psychiatric services at the same time, is a huge leap forward. We recognise that maternal ill health can also have an effect on the child's father or the partner of the mother. And we are therefore also offering partners of women accessing specialist perinatal mental health services and maternal mental health services evidence-based assessments for their mental health and signposting to support as required. In the future, partners of expectant and new mothers who are seriously unwell will be offered a range of help, such as peer support, behavioural couple therapy sessions, and other family and parenting interventions. We are also taking forward work to ensure that all babies and young children in England receive the best start in life. And I'll come on to the early years review, the Secretary of State for Health and Social Care and the Prime Minister jointly commissioned the Early Years Healthy Development Review in the summer of 2020. And and it is important, so I just will say this again. The review looks across the 1001 critical days, and my honourable friend from the SNP member, a spokesperson, also spoke about the importance of those early 1001 days, from conception to the age of 2, ensuring babies and young children in England can be given the best start in life. Phase 1 of the review is in its final stages, and the vision for brilliance, setting out policy actions for the government, will be published shortly. I hope that my response goes some way to assure you all that this government remains committed to supporting mothers throughout the perinatal stages up to 24 months after giving birth, and to ensure that we can reach out to mothers who may need help coming forward about their mental health. I would like to end by talking about women's health more broadly. Pregnancy, childbirth, birth and motherhood are just some of the stages of life that many women can experience. And throughout the course of our lives, the physical milestones, the changes to our bodies and our experience of the world have an impact on our health. And I'd like to just reiterate again that we are having our International Women's Day debate here tomorrow. And I hope that at that it will be mentioned, the call for evidence will be mentioned, so that we can better understand women's experiences of the health and care system, but also, as I said at the beginning, their experiences of health, including motherhood, including maternity, in the workplace, because without that evidence from women, we don't have the data, we don't have the information in order to adapt and develop policies moving forward. I will once again, I just want to finish on urging all women to share their experiences through the call for evidence. It will form the basis of a new women's health strategy, the first of its kind, the first time any government has called upon women for evidence, so that we can set an ambitious and positive new agenda to improve health and well-being and ensure health services are meeting the needs of women everywhere, including and especially in perinatal mental health. Thank you, Sarah.
Sarah, I'll let you sum up.
Thank you very much, Sir Edward. This has been a really fantastic debate, and I am so grateful for the contributions of members both in the room and on the Zoom for their contributions this afternoon. Particularly welcome the contribution for their member for East Worthing and Shoreham. I've looked it up. And all of the work he's done, particularly as the chair of the APPG for the first 1001 days, and he's highlighted obviously the work of the member for South Northamptonshire, and I'm very, very much looking forward, as the Minister highlighted, to reading her review. I think that will be really interesting. He also highlighted the importance of fathers as well, and I'm really, really grateful to him for raising that. It's a very, very important aspect of the debate. And I'm also grateful to the member for Strangford for mentioning grandparents. And I don't know about you, but some of the most distressing correspondence I've had during this pandemic has been from grandparents who've been unable to see their new and hold their new grandchildren. And so thank you very much for raising that. And congratulations to the Minister on her impending grandmotherhood, and I hope that all goes very, very well. I'm particularly grateful to members who've shared their own experiences throughout this debate, and I want to thank particularly the member for Truro and Falmouth, and I think her own experience really highlights what I was saying about the inadequacy of telephone and digital follow-up appointments, and her own experience of postnatal depression, and I'm really, really grateful to her for sharing that particular thing. And if I could stretch out a virtual hand, I'd like to say to the member for Truro and Falmouth, we share the experience of baby loss, and I know how that is. I'm also grateful to the member for City of Durham for highlighting another really important aspect, that of babies who are born with additional needs and the particular needs of their families and how they have been affected during this pandemic. And I really, really hope that their needs can be prioritised going forward. I just want also to mention the member for Basingstoke, and it feels as if the mother's financial experience is almost an additional thing, but she's absolutely right in saying it's really central to mothers' mental health and to know that they've got that economic stability. So thank you for raising that. And I just wanted to pick up on the comments of the Minister at the end there. Really pleased to hear about the call for evidence. As I say, looking forward to the early years review. I do just want to push you on the point about not allowing digital and telephone consultations to become a norm in perinatal mental health, because that face-to-face visit is so important to mothers everywhere, and I really hope that can be embedded. Thank you very much, everybody, for your time this afternoon, and thank you, Sir Edward, for your chairing.
Thank you. Well, speaking as a grandfather, it's been a very interesting debate. The question is, this House has considered maternal mental health. As many of that opinion say aye. Aye. The contrary, no. I think the ayes have it. The ayes have it. Order. Sitting suspended for 5 minutes. Thank you very much.
Maria.